Hey, you made it back. I'm back. CST exam, 10 questions. I think you came to the right place if you're interested in reviewing CST information. Just to let you know a little bit of the format. We're going to go over 10 questions from the 4th edition, which is the gold standard for reviewing for the CST exam. Quickly go over 10 questions. I'll read a little bit of the rationale, give you the answer after I read it. So if you're interested in doing it on your own, pause the video, answer it yourself, and obviously you'll see the answer on the backside of when I'm done reading. I don't want to waste any of your time. I know you're interested in these questions, so I'm going to jump right into it. If you could just like and subscribe, that's going to help me with the algorithm, but I'm not going to waste any more of your time. Get right into these questions, make this video about 10 minutes, and here we go. We'll put the question up in front of me, right in front of my face here, and so you can see the question itself. And try to actually answer the questions. The subject matter today is going to be patient monitoring devices. All right, let's go put that question up in front of me. Here we go. Put it up on the screen here. Which of the following conditions might require the use of a Silastic urethral catheter? So is it prosthetic hypertrophy, hypospadia, latex allergy, or stress incontinence? What do you think? Why are we using a Silastic type of material? Well, if you didn't answer already, the correct answer is, well, how about I just go right to the back here and read what they say. If a patient has a latex allergy, that type of material, Silastic material, would have to be used. So if they're allergic to latex, C would be your right answer on that. All right, next question, put it up on the screen. A patient receives preoperative instructions to remove nail polish to do what? Allow completion of a nuclear medicine study, prevent an infection, prevent pulse oximeter from malfunctioning, allow arterial blood to be drawn. So what do you think? Why do we have patients, I'm pretty sure you heard that in your program, take nail polish off. But they say in the book, nail polishes changes the color of the pulse oximeter light beam, causing it to malfunction. Now, that's interesting. So all nail polish needs to come off with patients. So the correct answer on that was going to be C. Next question, we'll put that up on the screen. Which of the following confirms proper placement of a Foley catheter prior to a balloon inflation? Is it removal of a 5mm air from the balloon, collapsing of the catheter lumen, secure connections to a drain bag, or urine flowing out of the catheter? So which of the following confirms proper placement of that Foley? Now the book's going to say, I'll give you a second to think about it. Oh, your second is up. Here we go. Urine flow out of the Foley catheter confirms proper placement prior to inflation. So D was your correct answer on 3. All right, next question. Put that up on the screen. Why is an indwelling Foley catheter placed prior to a hysterectomy? So why are we putting a Foley catheter prior to surgery? Is it to record fluid intake? Is it to avoid injury to the bladder, distend the bladder, or demonstrate urethral patency? Is it open? So what do you guys think? Why are we putting a Foley in there? I don't even have to go in the back. If you know the answer, you know. And the answer is you want to avoid injury to the bladder. But let's just see what they say. Decompressing the bladder prevents injury to the organs during a hysterectomy. So an indwelling Foley catheter preoperatively inserted into the patient. So yeah, they want to have a smaller target, right? So if they are down at the lower end in the pelvic region, we don't want to injure the bladder itself. And if you don't know what indwelling means, it's a balloon. It stays within the actual bladder, opposed to a straight catheter, which does not have a balloon, right? So that was question number 4, and the answer was B. All right, question number 5. We'll put that on the screen here. Which type of monitoring equipment is a non-invasive assessment of oxygen saturation of arterial blood? So which type of monitoring equipment is a non-invasive assessment of oxygen? Is it an electrocardiogram? Is it a biceptal index? Is it a pulse oximeter? Or a capnograph? So what do you guys think? Why are we a non-invasive monitoring oxygen? Well, you should know it's the pulse oximeter. The other question kind of alluded to it, right? We want to have no nail polish to make sure that we good contact with the nails so the light can penetrate to see the saturation level. But let's just see what the actual rationale was. Pulse oximeter is a non-invasive assessment of oxygen levels. These are kind of elementary, but hey, this is in the book. You need to know this information because it could be on your CST exam. You never know, right? All right, question number 6. Which of the following assesses the electrical activity of the nervous system? Which of the following assesses the electrical activity of the nervous system? Is it a spirometer, electrocephalogram, the peripheral nervous stimulator, or electrocardiogram? So which of the following assesses the electrical activity? Well, you can probably put 2 and 2 together there. But in the book it says the electrocephalogram is a display of recording of electrical activity of the brain. So B was your correct answer on that, to monitor electrical activity. I imagine that's for neuro. Obviously they'll have probes and then monitor the activity throughout cases. Make sure you don't hit the nerves, right? Question number 7, we'll put that on the screen. Where should the Foley indwelling catheter drainage bag be? Let's read that again. Which should the Foley indwelling catheter drainage bag be positioned after insertion of the catheter? Right, is it above the level of the bladder, lower than the level of the bladder, or positioned in an, it's not important. Who cares, right? What do you think? Where should that Foley catheter, right? I'm pretty sure, again, elementary question, but you never know. Maybe you don't know this answer. Well, the Foley indwelling catheter drainage bag should be positioned lower than the level of the bladder. Why is that? We have an active, we have a passive type of drain, 2 categories. One works off a mechanical action, one works off gravity, right? In this case, we're going to use a passive type of drain, using the gravity for draining, obviously urine in this case. But Penrose drain, that's a active drain. A Penrose is a passive drain. A JP is an active type of drain. So sometimes they want you to know mechanical over gravity. In this case, a Foley is an indwelling catheter that helps drainage. And the answer was C. I was talking too much on that. We're on question number 8. We'll put it up on the screen. Which of the following is the tip of a urinary catheter dipped in to minimize mucosal irritation during a urinary catheterization? Vaseline, KY jelly, chlorhexidine, or sterile saline? So what do you guys think? Every time you set up a urology case, we squeeze a little in that left-hand corner on your table. What do you guys think? Yeah, KY jelly, that's a pretty simple question, is used to lubricate the catheter tip. Pretty simple there. We'll just move on to question number 9. What are we at here? 8 minutes and 39 seconds. Trying to get about 10 minutes. Question 9 is a system built into an anesthesia machine to monitor the patient's respiratory anesthetic gas levels. Is it a data scope, a pulse oximeter, a soda lime, or something called SARA? So what do you think? A system built in the anesthesia machine. I just had a person take the exam. They had a lot of anesthesia types of questions, and this is about their machine. What do you guys think the answer is? Well, the answer per the book, Systems for Anesthetic Respiratory Analysis, which stands for SARA, is a monitoring device incorporated into the anesthesia machine. It's used to monitor the patient's activity, respiratory or anesthetic gas levels. Well, that's something I just learned. I didn't know that. So, D is your correct answer on that. It's built in the machine to monitor the respiratory and the gases within the system or in the patient itself, the levels itself. So D was your correct answer. Yeah, there's a lot of questions in here that you say to yourself, wow, why do I need to know this? Well, it's good to know, I guess, but as a surgical technologist, we probably won't use these on a daily basis. But we need to know it for the exam. And it could be on your test. You never know. But now you do know. All right, we're coming to the end here, about 10 minutes. Outstanding. Last questions. Hey, I appreciate you kind of following along. I know I haven't had a lot of videos out there. Don't go away. I got one more question. But, you know, we're going to have some more lab videos. It's just been really, really busy here at the school. I have a little bit more time to do some videos. I want to try to make more time for the CST exam. And I really appreciate you guys subscribing, liking these videos. and spreading the word. Share them to your friends, right? Because that helps me out trying to get the algorithm. And obviously, we're trying to get more funds for the students for gas guards. That's the whole objective, right? It's not for Brad to retire, even though he will retire. You see the gray hair? Yeah, it's coming. It's there. Last question. All right, here we go. Put it up on the screen. Which of the following monitoring devices would be used within a vessel? Which of the following monitoring devices would be used in a vessel? An ECG lead, a Swan-Ganz catheter, a pulse oximeter, or a sphygmo. Yeah, that word. What do you think? Well, per the book, a Swan-Ganz monitoring device is inserted to the branch of the pulmonary artery to measure central venous pressure, the pulmonary artery pressure, the pulmonary capillaries, and obviously pressure in general. Swan-Ganz is something to monitor the function of the heart, right? So on question number 10, B was your correct answer, a monitoring device within the vessel itself. Anyways, we're at 12 minutes. I thank you. Hey, check out these other videos. The playlist is somewhere over here. There's a bunch of other CST exam. If you're new to this process, look at all of our videos. All right, so try to enjoy that, and I'll see you on next time. We're going to try to do some other lab videos, and I'll try to do some more CST exams. Hopefully you enjoyed it, and I'll see you on the next video. Thanks.